Here's the room I'm going to be doing my assessment in.
Come in.
Hi, how are you doing today?
Doing well, how are you?
I'm good. My name's Piper. I'm a nursing student at the University of Alabama in Huntsville, and today I'm going to be doing a bedside validation on you. Is that okay?
Sounds perfect.
Okay, it shouldn't take more than 20 minutes. First, I'm just going to sanitize my hands. Can I see your wristband?
Yep.
Can you tell me your name and date of birth?
Luke Johnson, 020205.
Okay, perfect. I just have a few questions for you before we start. Are you on any fall precautions?
No, ma'am.
Okay, do you have any allergies?
No, ma'am.
Okay, do you know your code status?
Full. Cool.
Okay, perfect. And before we start, do you need any assistance, like grooming yourself, going to the restroom, positioning yourself in bed, or are you independent in those things?
Independent?
Okay, and do you use a walker or a wheelchair or a cane or anything like that?
No, ma'am.
Okay, perfect. So to start out with, I'm just going to get a few vital signs. So if you could come sit on the edge of the bed for me.
Mm-hmm.
I'm going to first get your blood pressure. Do you have an arm that you prefer?
This one's fine.
Okay.
Whatever's easier for you.
This one will be perfectly fine. Just let me know if you feel any discomfort. Is that too loose or too tight on you?
That's fine.
Okay. Oh, sorry.
You're okay.
Okay, I got 124/78 for your blood pressure.
Good.
Now I'm just going to move on and get your pulse. Do you have an arm that you prefer for your pulse?
Whatever is convenient for you.
Okay, I'll just use the same arm. Okay, so for your pulse, I got 78, and then for your respirations, I got 18. Okay?
Mm-hmm.
So to start out with, I can tell that you're fully conscious. You told me your name. Do you know what we're doing right now?
Bedside assessment?
Okay, and do you know where we're at?
Charter Hospital.
Okay, and then do you know what year it is?
2025.
Okay, I can tell that you are oriented ×4. If I can just have you lay down for me, and I'm just going to assess your skin. So I noticed you don't have any aphasia or dysarthria. Your speech is clear. Your skin is going to be warm and dry. I'm just going to raise your pants legs up a little bit so I can assess your legs. Your skin is going to be warm and dry. I'm just going to be checking your arms for any lacerations or any ulcers. Okay, I don't see any. I don't see any swelling. No ulcers, lacerations. Do you have any pain?
No, ma'am.
Are you experiencing any pain anywhere on your body?
No, ma'am.
Okay, if you were, I would ask you the character, the onset, the location, duration, the severity, the patterns, and the affecting factors of your pain, okay?
Okay.
And like I said, you don't have any swelling or lacerations on your arms. I'm just going to check between your fingers. Okay, you don't have any fissures or lacerations. Now I'm just going to check your capillary refill. Okay, your capillary refill is less than 3 seconds on your hands. Are you in any pain in your legs?
No, ma'am.
Okay, do you feel any numbness or tingling anywhere?
No, ma'am.
Okay, perfect. I'm just going to be checking your legs for any lacerations or ulcers. Okay, I don't see any lacerations or ulcers. I also don't see any varicose veins or hemosiderin staining. I don't see any edema or swelling. I'm just going to check between your toes real fast for any lacerations. Okay, I don't see any fissures or any lacerations. And now I'm just going to check your capillary refill in your toes.
Okay.
Okay, your capillary refill is less than 3 seconds. I'm just going to sanitize my hands real fast since I did just touch your feet. Have you been experiencing a cough lately?
No, ma'am.
Okay, perfect. If you could just come to the edge of the bed, and I'm just going to listen to your lung sounds anterior and posteriorly, okay? So if you could just sit up for me. I'm just going to start with your lung sounds anterior. First, I'm going to listen to your bronchial sounds. So if you could just take a deep breath and out through your mouth for me. Okay, again. Okay, for your bronchial, your inspiration was less than your expiration, and now your bronchovesicular. Okay, for your bronchovesicular, your inspiration is equal to your expiration, and now I'm going to listen to your vesicular. Take that deep breath for me. Okay, for your vesicular, your inspiration was greater than your expiration. Okay, if you can just stand up for me, and I'm going to listen to your posterior sounds. I'm going to start with your bronchovesicular. So just take that deep breath. Okay, for your bronchovesicular, your inspiration was equal to your expiration, and now your vesicular. For your vesicular, your inspiration was greater than your expiration. You can just go ahead and have a seat for me. You said you weren't experiencing a cough or anything. I didn't hear any adventitious breath sounds, so no wheezes, rhonchi, crackles, no bruits heard. And the rhythm was regular, so that's good. The next thing I'm going to do is I'm going to move on to listening to your heart sounds. And with this, I'm going to flip from my diaphragm to my bell, okay? I'm going to start my bell. The first place I'm going to listen to is your aortic area, which is located on your second intercostal space, right sternal border. Okay, now I'm going to move to your pulmonic area, which is located on your second intercostal space, left sternal border. Okay, the next place I'm going to listen to is your Erb's point, which is located on your third intercostal space, left sternal border. next place I'm going to listen to is your tricuspid area, which is your 4th to 5th intercostal space, left sternal border. Okay, and the final place I'm going to listen to is your mitral area, which is located on your 5th intercostal space, left midclavicular line. So if you could just sit up for me. Okay, for your heart sounds, S1 and S2 were heard. I didn't hear any murmurs. The rhythm was regular. So that's perfect. If I can just have you lay down for me again, the next thing I'm going to do is I'm going to assess your pulses throughout your body. So if I could just start with your brachial pulse. Okay, your brachial is +2 bilaterally. Now your radial. Okay, your radial is +2 bilaterally. I'm going to skip your femoral pulse just for privacy reasons. So now I'm going to go to your posterior tibial. Okay, it's +2 bilaterally, and now your pedal pulse. Okay, it's +2 bilaterally. Now I'm just going to sanitize my hands again since I just touched your feet. And if I was to be like coming into contact with any bodily fluids such as blood or urine or anything like that, I would wear gloves. Now I'm just going to check your eyes. Okay. And now I'm just going to check your pupil size. Just look at me. Okay, your pupils are 4 millimeters each. They're equal, round, and reactive, so that's good. And now I'm just going to assess your abdomen and listen to your bowel sounds. Is that okay?
Okay.
Okay, if you feel any pain or discomfort, just let me know, okay?
Okay.
Can you raise up your shirt for me? Okay, I'm going to start in your right lower quadrant. Now I'm going to move up to your right upper quadrant. Now I'm going to move to your left upper quadrant. Now I'm going to move down to your left lower quadrant. Okay, your bowel sounds are normal active. Did you feel any pain or tenderness? Okay, I'm going to palpate your abdomen. If you feel any pain or tenderness, then just let me know, okay?
Mm-hmm.
No pain or tenderness? Okay, your abdomen was soft, and you have a flat contour, so that's good. Now I'm going to palpate for any bladder distension. Just let me know if you feel any pain or discomfort, okay?
Mm-hmm.
Okay, I didn't know any bladder distension, so that's good. You can go ahead and put your shirt down, and I'll just have a few questions for you. When was your last bowel movement?
This morning.
Okay, and is that a regular pattern? Like, are you on a regular pattern of going?
Mm-hmm.
Okay, and do you pass gas regularly?
Mm-hmm.
Do you have any pain or discomfort using the bathroom?
No, ma'am.
Or having a bowel movement? Okay. And do you have like a foul odor, or is it your bowel movement's hard or soft?
I'm like that.
Okay. And then for your urination system, do you have any pain or discomfort urinating?
No, ma'am.
Okay. And then do you have a foul odor from your urine?
Nope.
Okay, and then what's usually the color of your urine when you urinate?
Like the pale yellow, I guess.
Okay, perfect. That's normal, and I just have a few questions about your nutrition. How much of your meals would you say you eat when you eat your meals? Like anywhere from 0% to 100% of your meals?
100%.
About 100. And do you have all of your like your vegetables, dairy, protein, and all that included in your meals?
Mm-hmm.
Okay, and then do you eat 3 meals a day? Okay, and do you experience any nausea or vomiting?
Nope.
Okay, perfect. If you could just come to the side of the bed and we'll test your musculoskeletal system. Okay, if you could just squeeze my fingers. Okay, and if you just put your arms up here, you're gonna push against me. Okay, pull towards you. Okay, and then if I can just have you put your elbows up, and then you're gonna flex your elbows down and then back up. Okay, perfect. I didn't notice any crepitus or swelling in your joints. We're gonna do the same thing with your legs. Push towards me. Pull towards you. Push up with your feet. Push down with your feet. Okay, and then if you could just pull your legs out and put them back down. Okay, I didn't notice any crepitus or swelling in your joints and your knees. I'm just going to sanitize my hands since I just touched your feet. You have a +5 full range of motion for your upper extremities and your lower extremities, okay? Mm-hmm. You can just go ahead and lay back down for me. And I think that concludes my assessment. Do you have any questions for me?
No, ma'am.
Okay, your bed is in the lowest position. Your side rails are up ×2. Your call light and personal belongings are right here. And just thank you for letting me assess you today.
Yeah, thank you.
I hope you have a great day.
You as well.
I'm just going to sanitize my hands again on the way out.
Sounds good.